Okay, this is a testing. Nope. I think it's, yep. Yeah, this is a testing. Nope. I think it's, yep.
But it's saying live on custom streaming service. Oh, just lost you guys.
Yes, we are live now and we are streaming. We are
and
on.
It's working. You're back. Okay. There for a minute, I lost all of you.
We've got you here.
I'm here. I'm back again. I just want to make one comment on our cover for all our papers that are brought in this Halloween October. I don't know where you girls find all these good pages every month to put on the front of all our information. Thank you. I just love them.
Once again, I'm happy to see our Board of Health has gone into a new dimension. The most points for creative background on a Zoom call.
This is the Division Street building, isn't it?
Yeah.
I'm hoping not. We look at that with cherished value. So
Really? I didn't cherish it that much.
wow, everybody is really up in the game on the background.
Yeah, look at that.
Competition.
Jim's coming from the Nicholas Conservatory.
Oh, it's beautiful.
You gotta turn your mic on, Jim.
What I'm doing is walking out at Midway Village on one of the sunny days that we had.
It's not today.
Not
Gotta say,
today.
Jim, I walk over there lately and I haven't seen those purple flowers. But maybe we should meet and walk one day.
Maybe we should meet and walk one day. Then you might see the purple flowers.
Maybe I would.
And just a reminder to everyone getting on the call, we are live. We are live streaming and we are on YouTube.
So I heard we're top 10 on YouTube. Is that true?
No.
What was your background tonight, Ron?
It's our old Division Street building, isn't it? Board of Health. Or it's a haunted castle of some kind.
Haunted houses aren't allowed.
I'm thinking of Harry Potter.
Haunted houses are allowed. You just can't leave anybody in.
It looks like the haunted house down at Disney World.
Ah.
Isn't there a Board of Health, down at Disney World like that?
What? We are. We're recording. Thanks.
Well, one thing the pandemic has done, it's allowed Cheryl to come to our meetings. Or it's punished Cheryl in having to come to our meetings.
No, no.
But it's nice to see you, Cheryl.
Thank you. It's nice to be here. Oh, I love your background. Yeah, those fall colors. Beautiful.
On an earlier
You're on
Zoom,
mute, Dr. Martell.
Todd Marshall is checking someone in at our alternate housing. And I believe Todd Kisner should be getting on shortly too. So I'll send them an instant message.
Good evening. Do we have enough for a quorum yet?
I think so.
Good.
You have 6. 7.
7, no.
We only have 9 now, right?
We have 7 with Angie here. Angie, can you hear us?
Yeah, Angie's on.
Yeah,
Yes, I can hear all of you.
good.
So don't be talking about me.
Well, we haven't started yet, but
Okay. Good
how many
seeing all.
board, me-
Very
how
good
many
seeing all.
board, me- how many board members do we have right now? I mean, total.
5, 6,
We have 10, don't we?
11. I count 11.
Okay.
11. We don't
Christina's
have
saying
11.
10. Christina's saying 10.
10. 1, 2, 3, 4, 5, 6,
10.
10.
and 6 is a quorum, isn't it?
Yeah.
Where is,
Okay.
haven't seen the alderman for quite a while.
Was
We'll go
John,
ahead
was
and
John to
Are you
come back?
None of them come to us very often. They start out and then they leave us.
I wonder if, like, trying to remember John's last name.
Loggerman.
Logeman.
Yeah, something like that.
Because he's back now. I wonder if he'll pick up, and where he left off. Would be nice if he did. He seemed like he'd be a really welcome addition.
we'll go ahead and call to order because it looks like we have a presentation and there's a couple correspondence we need to go over at the end. We need approval of the agenda for October 20th.
So moved.
Second.
Excellent. Any discussion? All in favor?
Aye.
Aye.
Any opposed? Excellent. We need approval of the minutes.
Move approval.
Second.
Excellent. Any discussion? All in favor?
Aye.
Aye.
All opposed? Excellent. Interesting should be the COVID-19 data update.
Okay, good evening. Thank you very much. You all have the update in your packet. I'm going to see if I can share this out on my screen and see if that'll work. Can you all see it?
Yes.
Yeah. Yes.
Yeah.
Good. How's that?
Good.
So this is an update from, we do this on a monthly basis. I appreciate the opportunity to give you a chance. Again, some of the slides I'll go over rather quickly, but some I want to spend a moment on because there's a couple of things that we wanted to point out and share. As of today, we're at 9,096 cases, and our positivity rate for a 7-day rolling average is at 12.7. So it continues to go up, as you're all aware. Um, we're over 110,000 tests that have been given in the county. Both molecular and antigen tests are being used, and that was a change as of last week, that the antigen tests are being reported in as well. We've talked about R naught and the infection rate before. This is just sort of a reminder of what the theory is behind it. And then the next slide really shows where we are right now in Winnebago County. You want to be below 1, and right now, according to a couple of the different sources that do the calculations, we're definitely above 1, just above 1 under the Children's Hospital, and at 1.13 according to COVID Act now. So that's problematic, but now it's across the state. We're seeing the issues. Certainly with what Governor Pritzker has been announcing, it's not just Winnebago County. Again, talking about the testing that's going on, there's over 10,000 tests a week that are being done. It's ranged from 6,000 or 8,000 to over 10,000. And individuals certainly at this point may have more than one test. They may have been negative, they may come back positive, they may have been exposed, though, and those are all in the denominator. Those 110,000 are not each unique individuals. There are duplications in there. Tests are throughout the community, pop-up sites, the IDPH sites, the health systems and medical offices. And we're seeing, with high volume, I think it's having an impact sometimes on the turnaround time and reporting time and being able to get reports out from the state. Results. This is our cumulative slide, and I guess what I want to call out is, in last couple months, we've been able to say that the rate of increase was slowing, that we were sort of in a plateau area. We're not really in a plateau right now. We are on an upside of another acceleration of cases here, and that's reflected. You can see that in the upper right-hand corner. Similarly, when we've tried to talk about how quickly did the number of cases double, early on, when we had very few cases, it didn't take a lot to double. When we hit that plateau again through the spring and into the summer, it was taking a long time. And what we've again seen with that acceleration is the doubling time, again, unfortunately, is kind of shortening. This is yet another way to reflect it. This is based on date of onset. And what you can really see is our initial hit that came in the springtime is that first set of peaks. And then again, our daily case counts were relatively low until we hit the middle part of September. And then you see it start to peak again. So all the different indicators, no matter how you slice the data, really shows that we are in the next wave. Positivity rates. So this table really shows the cumulative, so of those 110,000 tests that have been done, sort of what overall, if you were to average out across all those tests, what's the positivity rate? It's not the most current, but it's, the cumulative over the months. You can see that early on when testing was very restricted, it was high. Then as we started to do a lot more tests and the case rates were slowing, it dropped and it dropped. And now you can see that we sort of hit a trough or the bottom of that in September. And you see that overall average starting to creep up again. So that positivity rate keeps impacting us, and we're seeing it reflected in a variety of ways. The overall age distribution of cases and deaths hasn't really changed over time. It's shifted a little bit. We've always had very high rates, sort of in the 20 to 29-year-old rate. That 10 to 19, those school kids, though, last month they reflected about 14% of all of our cases. Now they're up to 16%. So we're sort of seeing a little bit of an increase there as we see those cases hitting school-aged children. But overall, at this point, it hasn't dramatically shifted. Race and ethnicity of our cases. This actually, we have seen a shift here, and this is interesting. This is what our current distribution looks like, and really, it's the Hispanic Latino population that's around 11% of our population, but it still is reflecting almost 24% of all of our cases. Now, a few months ago, go to the next slide. This is comparing that same pie chart at the end of July with where we are now. The chart on the left was the July table. And what you could see at that point was the African-American Black population reflected almost 24% of all of our cases. What we see now, it is reflecting only about just over 14%, which is much closer to the normal distribution in Winnebago County of the racial disparity. And so what it really, and so we're trying to look into that more, but we looked at what was going on kind of month by month, and we could see that the African-American community, those rates went up very quickly, very early. That spring, that initial wave, that community saw a lot of cases coming through. In the more recent month, it's coming in at a slower rate. And so the distribution is kind of shifting a little bit. We'll also see that when we drill down at the zip code and community level, but let's talk a little bit more about if we look at by age and race and ethnicity and sort of trying to slice the data. The Hispanic, Latino, and African population, again, are both overrepresented overall in the cases, particularly at the younger ages. We see that. We look at age-adjusted case rates, and we've shared this in the past. Overall, because the number of cases goes up, the total number of case rates has increased. But what we really see is for particularly the Hispanic Latino population, a real increase when we adjust the case rate by the age of that population. I mean, there's definitely an increase for the Black population. There's an even more dramatic increase for the Hispanic and Latino population in terms of the case rate per 100,000 people. And then for the white population, you see it drop. Not a lot, but it does drop. Looking at just by gender, women are disproportionately impacted by COVID, whether that's as frontline workers, essential workers, caregivers. It's pretty significant that really from the age 10 on up until 60, you see that increase of share in the numbers. Oh, I'm jumping. Come on, behave. We can go here to, this is the communities of concern. Again, we've shared this before, and we sort of report this out internally every day. It's in our weekly report. We look by zip code and we look at what the case rate per 100,000 is. And when we first did this a few months ago, it's the same top 5 zip codes. The ordering has changed a little bit, but it's really the same zip codes. But the difference between the highest rate in 61108 compared to the county's overall rate is decreasing. So the disparity is lessening, but it's not necessarily because they're doing so much better. It's because a lot of the rest of the county is doing worse, and they're coming up more closely. And the same top 5 overall are the same top 5, but the next 5 highest are right behind them. So that difference isn't as great. One of the ways we wanted to take a look at that is on this chart, those top 5 where we've had the highest rates all along are represented by that thick, dark blue line at the top. And what you really can see, this is their how their case rate has increased over time. You can see that early on, those communities went up high, and then they sort of, since that initial increase, they've kind of moved at the same kind of pace as the other zip codes that we're showing on here. But the other zip codes that started much more slowly, you really see them starting to peak and accelerate again with this latest wave of increase. This second wave that we're seeing, you see this big increase, and that's really representing more of the communities that are outside of the city of Rockford. You're seeing Cherry Valley, McChesney Park, South Beloit, Roscoe, sort of the Rockford, New Milford area. Those are all showing a more rapid increase, and their case rate is coming up, and it's getting closer to what those communities of concern is. So that's really, it's kind of showing how the spread is shifting and where the cases are growing more rapidly. And so when we talk about messaging or areas we need to focus on, we need to make sure that we're capturing those areas as well, because the look of where our cases are is shifting. Now, let's talk just briefly about schools. This is just sort of, this is when the schools opened. And now they've all been up and running. We work closely with them. There's weekly calls, there's daily questions. We did a red cap survey. I think I shared this last month. We're giving reporting back to the schools now. We're able to report back in terms of when likely return times would be for students who are out. This table sort of shows in age bands, which would very roughly correspond with preschool, elementary, middle, high school, and then college age, sort of week by week, how many new cases we're seeing. And those cases, and when we talk overall about cases, we also would be including, not in this particular table, but teachers and staff when we report out on the schools. We talk about congregate settings. Again, this has not changed much as we've reported it over the months in terms of who's being impacted in the mix of residents, employees, what types of facilities they're in, the race and ethnicity. None of these have really shifted that much over time. They're sort of looking still like as they had been. When we look at the deaths, again, this ratio is not, we've been sort of in a 2-to-1 ratio of most of the deaths we see are in nursing homes or communities of congregate living settings. That ratio has been pretty solid all along. And this is, again, sort of another way of looking at morbidity and mortality. Not that many of the cases are in long-term care facilities, but a significant percentage of the deaths are. So one of the other things we want to talk about is the occupations or the exposure for reported cases, and this is based on self-reported through interviewing. The number one category is none, and that really this isn't a blank where they didn't answer it, but there was no occupation given. So that certainly includes retired and not working. Healthcare direct workers, this order, the first 3 are the same that they've been every time we've presented this. The new one on the list is number 4, students. For the first time, now we see again with what's happened over September and into October, that's the next most frequent response, and that pairs up with food service workers, retail workers. So everything else on this list have been on the list before and in the same order, but now we see students have come onto this list as well. And less than 1% teachers, school staff, and folks like that. but they are in their own category. This has not really changed. These are the comorbidities that are associated, and hospitalization when you have more than one, or which ones trigger things. And then when we look at causes of death, as terms of a final cause or a contributing cause, 75% of them include COVID-19 as one of the final causes. You can read this slide. Again, this is not substantially changed over time. Some of the percentages have moved a little bit, but it's fairly stable. And then these are the last two slides are really just what's out on the IDPH website. These are the county rankings as they now stand. We are under warning for 3 indicators. And then at the regional level, as we all know, we are in mitigation status. I know I blew through a lot of information fairly quickly. Are there any questions?
I have a couple, Peter. Maybe it's just retirement that has fried my brain, but I'm trying to think, when I look at positivity rates, what is the time frame of positive tests that is incorporated into that rate? When we look at it as an ongoing measure, we get those reports all the time. The state is watching them.
So what we report out is the 7-day positivity. It's a rolling 7-day average, and the state lags. We follow the state's methodology, and so it's lagged by 3 days because the data is always coming in. So we are reporting out a positivity rate that's showing a week's worth, and that takes your daily variability out. So of which centers, some testing sites are open on the weekends, some are not. We have bad weather, a site could shut down and things like that. So using a 7-day rolling is what we use, and it's then lagged by 3 days, and it's updated every day.
And that's what the state uses when they call us on the carpet for our positivity rate?
Yeah, that's what they're looking at.
Okay, one more question. As we've done tracing, especially in the schools, are the school rates distributed across the community just like everybody else in the community, or have there been clusters in any of the schools?
I'm going to let Todd probably jump in on this one, but I guess what I would say is, and I probably should have included this, we do a weekly school report that also comes out on Fridays, and that lists all the schools where we've had reported cases, and we're highlighting those schools which are new each week that are coming on. And the list is getting longer, but as far as any particular schools, I don't know whether Todd might have something to be able to speak to on that.
And probably as well. So Pat, while we've had cases in the schools, it's important to understand this. So there are cases in schools, but none of them, we've not had transmission in schools, which I think is an important, when we're looking at whether schools should remain open or closed. In light of a high positivity rate, we look to see, are the kids and the teachers transmitting amongst each other? And what we're finding is that the infections are being acquired in the community and are being brought into the school, and they're not spreading with the school. I should also, the school guidance criteria is extremely strict, meaning if you have one or more symptoms of COVID-19, you are excluded until you either have an alternative diagnosis or a negative COVID test. And so we have a lot of quarantining going on for that, which is, I'm going to say, children are much more, it's easier to enforce in the school environment than it is in the real world. But I think that this has been the challenge, but you can see that they've really been able to protect the internal environments in the schools. Now, the longer the schools have been in session, the more likely they are to start up on the list. So South Beloit, if you look back at that timeline, they did an adaptive pause at the high school. So they did a close on, and to be honest, it was determined that two that they thought were friends outside of the school environment and spent significant amounts of time in each other's home. So oftentimes the schools are looking at what can they do. And when you look at total, and again, this includes, they also just, report to us anyone who's in remote learning who is also called in sick, because, they're taking daily attendance. I think there's a misnomer out there. The schools are really tightly taking attendance and class participation for both remote and in person. And when you look at the ratio of staff to teachers, it's really 5,000 staff system-wide, about 50,000 teachers system-wide. That includes RPS 205 and then the Boone Winnebago district. And we are seeing a little bit more depends upon 1 to 3 from adult to student age in that particular population. But I think it's really a tribute. I call them the guardians at the gate. Is been the school nurses, and they usually have a COVID team in there that you cannot pass go. You cannot get in. There's a self-certification process. Anyone with a symptom is excluded, and then of course they're put out, and their family members also must quarantine. So if I'm a student in the first grade and I have a symptom of a runny nose, and I am excluded, then my siblings who might be in middle school and high school are also excluded. And if my parent's a teacher, we call it the trifecta. We all are quarantined during that time, and we return to remote learning until I'm cleared of COVID and the whole family unit can return to the in-person learning environment. So that, I think when you see about how tight social mitigation could work if we really followed it, even in the bigger community, would be very helpful. It probably could keep our positivity rates lower. And so I think that that's been something, but again, we continue to monitor. And it's concerning that we have such a high positivity rate surrounding many of these, I'm going to say critical services, whether it's schools, whether it's healthcare, fire departments, any of the above. Tad, do you have more on the school front? Because I know you and I'm kind of like the school lead with Capricia and Michael.
Yeah, so I think you've said it pretty much, Dr. Martell. We really do watch to ensure that transmission is not happening within the school person to person. So we've been very fortunate in all the work that we've been doing with the schools to ensure that we get kids that could are considered a close contact out of that school environment, in addition to that case, or in the event where we feel that exposure may have occurred across the classroom, then quarantine that classroom. We've been, I think, successful in keeping transmission out of the schools right now. So hopefully that'll continue.
Thanks.
Sandra, can I ask a question? The new policy for indoor dining, what led to that? How did it come about?
So the question is, it's not a new policy on indoor dining. I think we have to be very clear about this. And I know Marshall would chime in right away with me. So when the additional mitigations were put in place in Region 1, there was no indoor dining, but there was allowance on social gatherings of 25. And it included in that things like, think about weddings, funerals, potlucks, was all included. And so we had this scenario where bars and restaurants were often the venues for those social gatherings. So think of a baby shower, the Chamber of Commerce breakfast, a business meeting, a funeral luncheon. All of these things were part of that. And so we recognized that we had to put guidance together, because otherwise every restaurant you could imagine would say, I'm just doing meetings. And so we got together with our work group and came back and said, what is our community standard related to this? Right. And so what it was that we identified, you still have to keep to the 25, right? That's part of the limitation on the additional mitigations, that there were certain standards that we would expect to meet. When you have a meeting, it all starts at the same time. We don't all wander in at different times. There's, you have to contact trace, so they have to give us names and addresses. With the new mitigation and our high positivity rate, the other thing that came into effect is that you can't sit with anyone outside of your household. So if you are going to a meeting and there's going to be 25 of you, there'd be 25 tables set up 6 feet apart, because the risk is associated with when you take off your face covering and you eat with someone, and it's typically closer than 6 feet. And probably that's the number one behavior that we're seeing is been identified. And the place that people do that most likely at are bars and restaurants. So really was the guidance was to make it clear on what was expected when you were a bar or restaurant providing a meeting venue, social gathering, any of that, so that you couldn't just say, oh, we're all, you could imagine what all the loopholes they were giving us, Ron, in terms of, I'm just doing one big meeting, and it's continual. And so you see the restrictions, it's on our website, and it has been, and our group worked through it because they recognized that there were, I think, again, we always hear about the exceptions, not the rules, right? The exceptions, and we post all of our enforcement activities on the website. This is extremely difficult for them right now because, as we've said before, and we were very clear, they've been disproportionately impacted on these additional mitigations. I cannot go into your home and tell you not to have, 25 people. The number one places they identified in things were really became work, school, bars, restaurants, kind of, and you'd have trickle out where the places people at. And I think that the idea was you could not restrict people from work. You could not restrict, we wanted to keep the in-person learning environment. And so what mitigations could be applied. And I come back to the number one behavior that you do in a bar or restaurant, because that's why you go to the bar or restaurant, is to eat and drink and socialize. And this virus tends to like that environment and tends to spread in that environment. So we had no one particular location per se. It's not Sandy's restaurant or Todd's Bar and Grill. It was across the board. And so really trying to understand, we're one of the regions that went into mitigation at the beginning of the colder weather. And for us to get out of this, it's going to be extremely difficult because we have got to get ourselves down to 6.5% positivity rate for 3 consecutive days. And of course, you have to maintain it. So we just saw another region, 7, who'd been out of mitigation for less back into mitigation. And so there is something about this virus in the indoor environment that is very concerning. And so whatever we can put in place, the idea being if you heard the state put out guidance as well on Thanksgiving and how to have a safe event, we had to really tighten up the guidance on meetings, social gatherings, and events held at bars and restaurants so that it was not open indoor dining.
Thank you.
I have a question. With trace contacting, with such high rates just in Beloit, just on the other side of the state line, have we seen with trace contacting that some of that has seeped to the South Beloit and the McChesney, Rockton area?
I'd have to run a report, Dr. Williams, to see if there is a connection with folks going over the line into Beloit, whether it be for dining or whatever activities up there. In looking at the majority of what we have been seeing is these small family gatherings, either relatives come to visit from out of state, or we've gone and met someplace, not to pick on the Dells, but maybe the Dells for a long weekend and stuff. And so, family coming from out of state to visit us here, we go there, has been a big part of, or situations where an instance of a bachelorette party, went to Florida, 9 ladies had a great weekend, but came back and 6 of them are positive. So we're seeing a lot of those things where everybody's used to doing things, and they're not really realizing the potential exposure risk that they have by either going to Florida, as Dr. Martell has always been talking about, it's those contacts you come into. The more contacts you have, the more chances you have of contracting COVID-19. So it seems to be, we haven't had any mass house parties or anything like that. All the things that we've had a gender identity party, revealing party, i.e. a baby shower. You know, the fancy word that I just call a baby shower. But again, there was that opportunity where a couple individuals were infected at the time of the baby shower and didn't know it at the time, but then exposed everybody at the baby shower, including the mom to be in that situation. So, you know, I wish I could say it was one big event, but right now with our contact tracing and the information coming out to those potential clusters, it's been small gatherings, family gatherings, that type of scenario, or, you know, as we saw Labor Day weekend, you know, parents taking several kids' friends up to the Dells or, you know, to a cabin, and lo and behold, you know, somebody was positive, and therefore, you know, everybody in that small group exposed. So, but I'll definitely take a look and let you know.
Well, and again, I think Dr. Williams, I think that's one of the concerns is that when you look at Illinois, we were as a state, we're doing very well. The states around us, Iowa, when you look at Joe Davies County in Region 1, I'm going to say had a big positivity rate related to, you know, slipping across the border into Galena. And we also saw our South Beloit caseload, you know, Beloit and South Beloit go across on a regular basis. As we recognize, Wisconsin has a very high rate of infection. For anyone who's an Illinois provider, we've all been asked to go to the hospital in Green Bay or where Milwaukee, see if we can sign up and move on. I'm like, oh no, we have to stay in Illinois. We're busy, right? We're busy. But I think that is a concern that you see the governor being increasingly concerned about this. And our travel guidance, we've been again, we are not a home rule community. We cannot issue a travel ban, so we issue travel guidance. And to Todd's point, we've seen all kinds of one-offs, everything from you saw blips around the holidays, and that's what you saw the big increase mid-September. What did that reflect? 2 weeks back, what was that? You're starting to get into the Labor Day weekend. We had kids returning to college campuses where there was high infection rates. You know, University of Iowa, University of Wisconsin-Madison had some significant cases coming in. And, you know, again, if they didn't have a plan for quarantine for bringing the students in, that's where we ended up with, and they came home that first weekend back. And that's a big concern as we move to the Thanksgiving holiday, is that we'll have returning college students coming in again, kind of coming into a household that they haven't been in contact with on a regular basis. And family members may be gathering. And so that whole idea about, you know, face coverings inside your home with people who are not usually in your home, that's a very hard concept. People are pandemic fatigued. I mean, there's a lot more being documented now in the literature about this, and are just kind of throwing caution to the wind. And you see some of the schools having to really consider, what is that going to look like? Should they plan to go into remote learning? You see the debate in the, you know, newspaper and the news media. Should they plan to go into remote? But then if you plan to go into remote, how do you come out of remote, right? Because then you go into the holiday season, then you have the January holiday. And then if your rationale is that they're all going to be, you know, hard to keep the family gatherings and I'm going to say the kind of social gathering, you know, mentality down, then the holiday argument, then you're really in remote for almost to mid-January when you're in peak indoor season then. So that becomes, you know, a lot of them are really working very hard to keep in-person learning in place for as long as possible. This is why some of that guidance, back to Ron's point, when you're, you know, when you start thinking about planning a baby shower at a restaurant with all that tight mitigation, probably it'll be safer, because most of the time you're not going to be allowed to sit. You might be sitting at a table by yourself at the shower, but you're not going to be mixing family households as much. And that's been kind of that guidance it's going to be very difficult over Thanksgiving. And I I know a lot of people are already making those plans. I heard from the FDA, the director of the NIH said that they are not going to be having holiday gatherings at his family. They're going to Zoom dinner. And again, this is a good time to patronize our local food establishments and do carry out. Maybe change a new tradition just for this year, but it is very hard to change human behavior over this. And so many cues are in place in your work environments. I know I went for a dental appointment. It was like the Michelin man was taking care of me. And you realize how many things are different in our work environments, in our school environments, and the masking and all the social distancing, the plexiglass. And then when people come out of that and they go into a bar, restaurant, or a festive situation, it kind of like all those cues disappear. And I think it's really hard to keep the line. So we're going to have a tough road. But, I keep saying we can do it. We've done, we can kind of move through this before, but we're going to have to get our minds and wrapped around that this is what we need to do, that we're living in a pandemic and we can't do things like we've always done it. So to Ron's point, haunted houses are not allowed in Winnebago County, but trick-or-treating is, and we have guidance out for trick-or-treating and haunted hay rides if you'd like to take a haunted hay ride.
Dr. Mattel, the local news media the other day reported that 33 businesses had been put on a list.
Mhm.
Was that a list of some type of a discipline going to be
Yes.
awarded to them?
Yes. So everyone's clear. This is a process that has been in place since really, like, I want to say the fourth week and earlier September, is that as part of the Public Health Act, the pandemic was added as part of our public health code, right? So through the delegated authority of the Illinois Department of Public Health, there's a 3-step process. And so we worked through that with our food group as well, told them this is how this works. You first get a notice of noncompliance. So that was related to the masking. Remember, the governor issued the executive order related to masking. And then also 50 was still our gathering size. Remember, as part of our recovery numbers. Again, there was a whole kind of discussion that went on. So if you are first issued a notice of noncompliance, we get many complaints. Cynthia's there. She can attest to the call hotline. So we go on and we validate the complaint first to provide the education. And Todd Marshall's team goes out, they review the executive order, they identify, first of all, we know some people will complain and it may not be accurate, right? It may just be a one-off. But if we go into an establishment and it's got signs up that mask is required, that masks are available, that most of the employees are wearing masks appropriately, we always have one, we all know it, we've always got one that we got to work on. But if they're in compliance, then we move on. But if we go in and there's no signage up around masking and people are not distanced in that facility. So if they're shoulder to shoulder at a famous, around the rail at a bar watching a game, no one's got face coverings on, the person, behind the bar has not got it on, they're going to be given a notice of noncompliance. And then they're going to be reminded, we're going to go back out there to enforce it. And if they don't, then they get an order to disperse, meaning we can go in there, ask them to clear the building out. If they still don't continue to comply, then we move to a closure, which is we've always had that order to close capability within the Public Health Act. So, I remind everyone that that's an authority that flows through for any communicable disease. And we have used that at other times for food establishments as part of the process. So I want people to be aware it's up there as our commitment to the community who said, hey, what's happening with all these places? Those notices go up so that everyone's clear that those are establishments that have been issued that process or in the corrective action, I'm going to put it, as well as if you are a customer, then you should know and make appropriate choices as well. So kind of both in that process. And so if they are in compliance, and we will take them off in 30 days if they've got demonstrated continued compliance. I think everyone's very much aware about the media that we have many food establishment, not many. We have some that are very vocal that they are not going to come into compliance and are outright defying. And so we still have to go through the process, and we will continue to go through the process. And so the procedure is outlined on our webpage. So there's a link to that, as well as the updated closures and all the different orders, mitigations that go up on these particular establishments.
Okay, thank you.
If we order closure and they stay open, what do we do?
Well, first of all, we do refer them to the state's attorney's office for review. The state's attorney, if they take no action, and we will go out and reissue, because we can close for 48 hours without the court petition at that point. As you would guess, that merely becomes a revolving door. We have also reached out, we are reaching out to the Attorney General's office and the Office of the Governor and the Illinois State Police for the next level, because it's, as you would guess, a very contentious time. But it's also an equity concern for the business establishments that are in compliance. They are losing that business. And to all honesty, we don't know how many of these places, when they're shoulder to shoulder packed, when we've got a positivity rate up around 12%, how many of them might be contributing to super spreader events. And then when we go to contact trace, they're not giving up the name of that establishment. They are not. I mean, let's not kid ourselves about what this is. We ask people to be as honest and forthright as they can, but they're not going to tell us precisely that. They'll say they were out. They'll say, oh, I got it at work. I mean, I cannot tell you how many employers have been told it's all at the workplace. And I have to say that we really have to work on this as community members to hold our establishments accountable. It's hard to police ourselves out of a pandemic, but we do need to take steps for enforcement. I know I saw Todd, I'm sorry, he's moving around here. Todd, do you want to add? Because I know that's been the brunt of your staff.
No, I think you stated it quite well. It's been challenges. Obviously, we've been busy logging, tracking, going through that enforcement process, the 3 steps. And yes, we're hoping it was more education, but obviously, as everybody knows on our websites, getting into enforcement. So.
Excellent. Let's see, committee report. Executive committee, nothing. Finance committee.
Finance committee, we will move first to approve the minutes from the October 14th, 2020 meeting. Do I have a motion to approve?
Oh,
thank you. Do I have a second?
Second.
Okay, all in favor of approving the minutes, signify by saying aye.
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 So passed. We will move into the resolution of financial statements for September 2020, first being the resolution of expenditures. Which was found on page 27. For expenditures incurred in the health fund for September of 2020 in the amount of $779,527.48. Do I have a motion to approve?
So moved. Second.
Thank you. Any questions? If none, all in favor?
Aye.
Aye.
Opposed? So passed. Next, we have the statement of fund balance found on page 28. Just a moment. And this is our entire full year or fiscal year for 2020 from 2019 through 9 of 2020. We ended up with a balance of $10,421,821.75 for an increase over the from the start of the year to the end of this year, $849,261.77. For all that we and all departments have been through, I think that's very good. Anyone have any questions concerning that? None. We will move on to the financial review, which is page 29. As you can see, we have the year-to-date revenue, the budget, the actual and the variance, and also the expenditure, the expenses. Which is budgeted, that which is actual, and the variance. Do we have any questions concerning that? We'll move to page 30, which is the balance sheet. This is preliminary through September 30th, 2020. See the numbers. Estimated year-end fund balance of $10,421,821.75. Jim, do you have anything to?
Yeah, I will comment that we're still processing. I'm estimating an additional 109,000 in expenses that that we'll put forth, but a lot of our batches have been posted, but we still have bills coming in, and we're still doing processing of purchasing cards, and they essentially keep the payables open for a period of 90 days after year end. But I'm fairly confident in the amount. I think it's conservative. That we'll have a increase in our fund balance of 850,000 probably. We may approach six figures, but the funding is here now, and we're trying to do everything we can to get that, because the funding won't always be here, but probably a lot of the responsibilities will stay with us after the funding's dried up. So right now it looks very favorable.
Excellent. Thank you very much. We will see. We will move into the bank reconciliations. This is for your information. It is the 4 bank accounts we have: the general account, the lead account, the abandoned properties, and the state of Illinois e-pay account. Does anyone have any questions or concerns? Or Jim, do you have anything to add to the information?
No, we did sweep all the into the essentially our equity and pooled cash, which is the main account that the county holds, and so we're doing all right there. Also, we're able to collect about 850,000 in real estate tax receivables and turn those into cash and post those. So that bolstered our cash position quite a bit.
Thank you. Bear with me one moment. We will move to revenue and expense reports, which is page 43.
So that's essentially the detail. They're all preliminary numbers, but again, I feel good about them. On page 45 is kind of a summary. I'll be adding for the 3 days in September that aren't covered for payroll and related benefits, and then additional expenses. And then I kind of have re-summarized on the bottom what I anticipate our year-to-date revenues are and our year-to-date expenses, with the difference being the surplus for the fiscal year.
Jim, just a question. On the bottom of page 45, we have the year-to-date revenue, year-to-date expenses, and the year-to-date fiscal year and surplus. Are those parentheses in the correct positions? Am I misreading this, or?
Well, I guess that's kind of maybe that's bean counter logic. We accountants put our credits in brackets. So if there's a negative, that's an income, and that's actually favorable, that's good. and then we put our debits as positive. So I mean, I think if you'll notice up on top where they have the revenues on the line right above that in the middle of the page,
Yes.
starts with a negative 9 million and then 834,000. And then the number right below that, the expenses, is actually shows as positive. So, you know, many people accuse us accountants of being a little backwards. So that's why.
Okay, yeah, I'm used to the opposite, so it threw me just a little bit. Okay, thank you. Any other questions concerning the final year-end preliminary numbers? Okay, if none, we will move to our emergency reserve minimum graph. You can see that is very positive. Actually, as far as I know, this is the highest our reserve has ever been since I've been on the board. That is very favorable, especially in the times we are in. Who knows what expenses or needs may come. Any questions or concerns with that? Okay. We will move to accounts receivable. And which is on page 47. And
yeah, in the right-hand column there, I have what our receivables are per program, and some are estimates because we have not done the final billings, but those are all the due from for the due from grantors, and it's each and every program. The detail is in the pages that follow, and any numbers that you see in red are estimates because we haven't done the final request for reimbursement because sometimes they're not available to do, and then obviously we're trying to catch up. So, but that's kind of where we stand now with our receivables for year end. So we're farther along detail wise than we were last year.
The second to the last notation, 60404, the contact tracing, is that actually salaries for the ones we hired in late August, early September? Is that the 128,691, or does that also include all the equipment and such we ordered?
That's just what we have done in the month of September, because we've already filed for reimbursement against our deposit for the first 3 months. So that's.
Jim, didn't we get a quarter advance on that?
Yes, we did. We did. In the middle of the second page in very small print, you'll see in August we filed a reimbursement for $371,000 that went against our advance, and then in September was the $128,691 in red. So that's just an estimate for our expenditures under that program for September.
Okay. Thank you. Any other questions? If none, we will move into major expenditure requests. At the Board of Health meeting on October 14th, we looked over the major expenditures A through F, the IDPH electronic filing fee for death certificates, through the 2020 AmeriCorps and expense for AmeriCorps employee. Those went through committee and all were recommended they be approved. Do I have a motion to approve these expenditures?
So moved.
Do I have a second?
Second.
All in favor?
Aye.
Aye. Opposed? A through F are passed. G was a pro pharma vaccines through county corrections. This was taken by a email poll. and was approved by the board. This is for information only. The last major expenditure report is on page 101. Let's see. Bear with me one moment as I bring that up. And, oh, yeah, Sandra.
It's, if someone wants a motion, then we can discuss it. We'll describe what it is.
It is a Cool Cube coolers to transport vaccines. It is, I believe, a total number of 6 being ordered. 5 of the the more expensive, very impressive looking coolers, and 1 of the refrigerated temp cooler. This is for an amount of $8,195.16. Do I have a motion to approve?
So moved.
Second.
Thank you. Do we have questions or discussion, or Sandra, would you like to fill us in on this?
Mindy's here as well with Cheryl. We've been doing the offsite, we've been doing the drive-through flu vaccination clinics, and we anticipate that we'll have to be doing something related to COVID-19 vaccination, but these are the approved coolers that are now used for the vaccine transport. For those of us who used to remember the lunch bags that we used to use, these are highly sophisticated. They're almost like mini refrigerators, and they have temp devices, and they are beasts, and they are designed so that they can protect the integrity of the vaccine at a remote site. Mindy, did you want to add anything?
One thing I didn't realize reading about them was that they will maintain a vaccine temperature for 48 hours with no additional ice added.
Oh,
impressive. So we could assume that should the world suddenly resolve, we could still use these in the future?
Yes, we've been using, they really they use them last for flu season when they go to the off sites. We've used them when we do vaccination and the point in time homeless count. I mean, I have to admit though, they're beasts. They're they're not your standard little lightweight. But the idea being that we have 3 in hand, and for those of you, I want to remind you, we are doing a drive-through flu clinic on Saturday here at the health department. So if you'd like to be a casual observer, we can put you in a viewing area, a safe distance up with face covering on, and you can kind of watch what it is. But it's when you're moving multiple lanes of vaccine and you're taking out, it's been impressive the amount that has been given so far and how acceptable this has been for the population to get vaccinated. So this allows us to do not only multiple lanes, but also multiple locations on a given day. Right now, we'd be hard pressed. So we're planning for vaccinating quite a bit. And again, the idea being, we really feel that this was, and again, we're looking at it, we're using CURES money for it. It will be part of our, I'm going to say part of our emergency preparedness inventory that can be pulled out. And again, for any other vaccination effort where we need to maintain the temperatures.
First thing I'm sorry, Angie.
What time on Saturday?
Yes.
They are going to be doing drive-through from 10 to 2. If you're going to come to observe, we ask that you park over in Mendelssohn and then walk over, and we will get you into the building where kind of the group starts convening about 9 o'clock, and we'll have tents up and the group will be rolling.
This is not the first drive-through, correct? You had one last week?
We've had 2.
Yes. Okay, I've had several patients who went and they said it was amazing.
Cool. Good to hear that.
Excellent.
Very well.
300 vaccines at each of them.
Wow. Concerning these bags, are we also purchasing the memory lock temperature monitoring and data logging? As long as we're doing this, is it not worth the extra?
The data loggers that we currently use are very effective, and they're not anywhere near as expensive as the ones that come.
Okay.
But yes, we've had to order more data loggers, as you would guess, to keep all of this running, because you have to, you're really running a miniature, I'm going to say, pharmacy cooler out there.
Any further questions? If none, all in favor of approving the Cool Cube coolers for the vaccine, signify by saying aye.
Aye.
Opposed? So passed. Let's see. We will move into proposed contracts and agreements. At the Finance Committee meeting, we had one proposed contract that was with the City of Rockford Police, the TEP grant, which is a tobacco enforcement program through the police department and I believe the high schools. That was discussed and it was recommended for approval by the Finance Committee. So do I have a motion to approve?
So moved.
Second.
Thank you. Any questions or discussion? And that is for the amount of, I'm sorry, $9,972.48. If there are no questions, all in favor, signify by saying aye.
Aye.
Opposed? So passed. We have two new proposed contracts and the first is the No Shades Youth Empowerment, Teen Pregnancy Prevention, and that is in the amount of $3,000. It is an existing contract. Do I have a motion to approve?
So moved.
Second.
Thank you. Sandra, can you give us some information on this or do you have any questions?
Let me make a clarification on that. It is not an existing contract. It's a new contract. It is a contract that's within the TPP, but it's a new vendor for the TPP. For those of you, KFACT was one of our previous vendors and chose not to continue given the challenges of electronic participation. So Cheryl, do you have anything that you want to add on that?
No, just that we were very fortunate that this No Shades, they're an existing group. And so they're very excited to participate. And we're looking forward to being able to service a lot of our youth with this agency, with this program.
No further questions. All in favor of approving, signify by saying aye.
Aye.
Opposed? So passed. The final proposed contract is Lincoln Middle School Substance Use Youth Prevention Programming supplemental. It is a new contract. There is no amount agreed to it. It is budgeted. There's no amount agreed. Do have a motion to approve?
So moved.
Second.
Okay. Sandra, can you clarify some of this for us?
On the Lincoln Middle School?
Yes.
That is our substance prevention program where the programming goes into the schools to give the prevention-based education. And so each year we try and recruit additional schools to participate. Cheryl, did you want to add anything that's in your center?
Yes, just that saying that we're glad that for Lincoln Middle School, yeah, they're going to have the 2 evidence-based programs and they'll also be done virtually. And but yeah, that's about it.
I was going to say this has been a challenging year because all these programs that require this prevention education, we've had to move to virtual platforms. And schools, given the fact that some of them are in remote, blended, it's been a challenge to get the number of participants in order to meet the grant deliverables, but trying to get some continuing withdrawal prevention education, even with COVID.
Excellent.
All right. If we have no further questions, at some point it would be interesting to hear how they are going about this virtually and how we are drumming up participation, if that's possible, just for information. But if we have no other questions, all in favor of approving the substance use prevention program, signifies by saying aye.
Aye.
Opposed? So passed. And I believe that is it with finance.
Thank you so much.
Thank you.
Policy. committee.
Policy, we need approval of our minutes from our last meeting of October 14th.
So moved.
Second.
Any corrections or comments on the minutes? Okay, all those in favor, aye.
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 Opposed? All right. For the last two meetings, what we dealt with was a request for variance. And our September meeting, we wanted to get some more information and verification of some things. And in our last meeting, the committee is recommending approval of the variance request. It is for a holding tank to handle the sewage for 12220 Harbor Oaks in Machesney Park. It's a repair, a massive repair to the building, and septic is not practical anymore for that lot. And you'll see in your enclosures that Machesney Park responded with approval of what was being done on the site. That's what we asked. We wanted to make sure that what was being done met the requirements of the village as far as a repair, not a complete rebuild. And we have that from them. And also the staff has recommended quite a few requirements in the variance. The major one being a surety bond of $3 million that you'll see on the back page, page 130. That's to ensure that if anything goes wrong with the holding tank and a cleanup, environmental cleanup has to take place, that there will be funds to take care of it. Do I have a motion to approve?
So moved.
In a second?
Second.
I'm not sure I need it, but comments, questions?
I have a question. So have we done this in the past with the requiring the insurance?
I can answer that. No, in my 26 years, no, we have not asked for that. No. But obviously that's always been a concern, but we have never addressed it in that fashion. No.
And I think this, because of this, was being built in a floodway. And this was part of the discussion about this. You had not really approved anything that was new construction in a floodway.
Exactly. Thanks for clarifying that. So we have did repairs in floodplains, but floodways. This is actually new construction of floodway. That means it's right a river's path anytime that it rises. So hydraulically, it can lift that septic tank up, that holding tank, snap the pipes, which then will discharge sewage. So it is a big concern, and we do need to have something in place if we do have to do some cleanups.
And I read the letter. It's not technically new construction because if you keep one wall up, apparently that's still considered remodeling according to the village of Machesney.
That is correct, Dr. Williams. Originally, they submitted plans that they would totally remove that existing structure and start new. And past history, they've always asked for one wall or part of that structure remain so it could be considered remodeled. That's why the policy committee asked for clarification with a letter, and they did. So they actually had to change their plans.
Okay.
Any other questions?
And they asked for approval. I think there was a question to Ron. Remember, the question was, why did we bring that forward again? Is that the homeowner wanted, before they went out to get the surety bond, they wanted to have that initial step in the approval process. So that's why we brought it back.
Right. And also there was a little question about the amount of the surety bond from the engineer, which I don't know if you've heard anything else, Todd, from them?
No, I haven't. When I updated him when the dates of the board was going to meet, he did bring up that there was some concern about the amount. I haven't heard anything since then. That was before the policy committee last week.
Okay. So we may be coming back to you if they have some questions or concerns or that they can't meet this. Todd said that the premium on the $3 million bond is $30,000 a year.
That is correct. That was the information that I received from the engineer. I have not looked at to clarify or double check that. I have not. But Dr. Martell is correct. They wanted to get past this letter first. And yes, they will be addressing that in a future meeting. I'm sure of it.
Gee, $30,000 a year. That's almost as much as the real estate taxes.
Todd, can I ask a question?
Of course.
When we set that amount, what I wanted to clarify, there was something in my mind from a meeting that said in the policy meeting, the county wanted that level of a bond.
No, I think what was said was that they took the $3 million from normal contracting that the county does. And in normal contracting, they require a $3 million bond. And that's why I brought up that we may have to adjust that depending on if there is a reason for saying that 3 million is in excess of what's needed. I have no idea. But right now, this is the way the variance and the approval of the variance stands with a $3 million bond, surety bond. I think that's where we're at. More questions? Okay, let's have a vote on the motion for the variance. Aye.
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 All those opposed, nay? Okay, Steve's not here, so he can't say nay. That's all we got for policy.
He's thinking about us.
Thank you. Looks like Personnel Committee, no meeting. Quality Improvement, no meeting. We got an email. I got an email. I believe it was today about Election Day holiday, November 3rd.
Yes.
And so I asked Christine to share it. Yes, it is. Another area just during a pandemic, the November 3rd has been, and Cheryl, make sure I'm using the correct terminology. The county board took action to declare November 3rd a holiday based on state executive or an order as well. Is that correct? Am I using the correct term? I'm getting confused about all my legal terms.
Yeah, actually, it's not an order, but it's a change to the statutes that the General Assembly made.
Okay, that's even, and so there indicating that the public act that the elections code making a state holiday known as General Election Day, and that all government offices, with the exception of election authorities, shall be closed on November 3rd, unless authorized to be used as a location for election services. And so we really need, our Board of Health needs to take action on that so that we declare this day to be a holiday, and we would follow the policies within Winnebago, or the health department, so that, for instance, our contact tracers, I mean, obviously we will obviously have work that day, would be, receive pay for the holiday as they would in our current agreement. The other part is we'd like to encourage individuals who are not going to have a job related to the COVID to support the elections, either as volunteers, I'm going to say not really volunteers, but certainly as poll workers or election judges to support the effort. There is a need, they understand, for that day for more volunteers to support that as well. So we needed to bring this forward to the board so that they could take the necessary action. And Jim, did you get a kind of an estimate on the cost for working on that particular day? I know we didn't have much time on between finance and.
Yes, I did. I took a look at all the people that are essentially non-exempt or eligible for overtime, and if they all came and worked an 8-hour day, it would be roughly $19,000 that would be paid out. But if we don't bring people in, primarily if anyone comes in for WIC or for contact tracing or any of those, based on those budgets, there won't won't be any pain in our pocket because we'll be reimbursed. And there are room in those budgets for that extra holiday, even if they come in and work that day. Because per our policy, if they do work, they get time and a half for that holiday.
Make your computer easier to use.
I move approval of the resolution.
We need a second.
Second.
All in favor?
Aye.
Aye.
Any opposed? Excellent. Interesting correspondence. Can I just say something before listening to you earlier, if I understand right, there's been no evidence from contact tracing of transmission of COVID in the schools, that the transmissions occurred outside of the schools, correct?
Correct.
Okay. I just wanted to be sure because I read those letters and I'm sorry, you go ahead.
Well, those that are directed to the Board of Health, and you can see they have a series, those are the ones you are seeing. We get many, many more of this. And I think that, we really kind of just want to make sure that we are forwarding the correspondence. We do monitor the situation. Again, as we understand that there's growing concern about teaching and, positivity rate, but I want to be clear as well, school systems, the Board of Education and their school boards have control and authority over the schools as well. But we certainly are going through periods where we've had to quarantine entire classrooms for 2 weeks based on our concern that, depending upon the early grade level. So there's been lots of people quarantined, but we have not seen transmission yet in the school environment. And that's really because we tightly quarantine in those environments. But anything that was directed to the Board of Health gets advanced to the Board of Health.
Okay.
Sandra, they seem inordinately concerned with sanitation.
And they do. And we, just so everyone's clear, we do tell them, part of our follow-up to them is to refer that for them to work with their local school administration and to bring those concerns to them as well. Oftentimes the sanitation, what you find is that there's checklists and everything else that go into those school environments. And I think that there's also this, I'll be honest with you, it's very difficult and it's hard to explain to people that when we contact trace, and let's say there's a classroom of 20 children and I'm the child that comes down with COVID, you are not going to know that. We are not going to disclose that to you as a teacher. Now you may figure it out, right? And in the younger grades, if we quarantine the entire classroom, they're all going out for 14 days because they can't maintain social distancing with the way that they teach in those environments. So, we really are protecting the identity of both, if it's the student or the teacher in that case scenario. Now, in a high school or a middle school grade, we ask for the seating charts, the bus charts, where they go, and it may be again, where they sit in the classroom, 6 feet ahead, 6 feet behind. But if the teacher is more than 6 feet away, and it's not a classroom where there's going to be, I'm going to call it manipulatives, or, it's not shop class or driver's ed or, art class where they're going to be, then that teacher is not going to be quarantined. And I think that's very hard because I think they think when there's a case, everything's going to close down and I'm going to know who that is. Just for their own identity, we don't release it. And the same thing for the kids. And so I think that that's always create a little bit of tension about, well, won't I know? And the answer is not necessarily. And again, if it's a kid in the front row of the class, it may be all the kids in the front row and the teacher if they're not 6 feet away. But it's been a real challenge to kind of understand how we protect the confidentiality and privacy of both student and teachers and aides and, in those environments. And of course, they always think it's someone that it's not. And you have to kind of step back and say, no. And again, as well as, you have growing concerns about any person who's so frightened in their environment. How are they functioning in the environment then? If they're, so worried that they can't effectively function, no matter whatever that environment is, whether it's teaching, whether it's food establishment, whether it's manufacturing, and we get all the full breadth and depth. Now, proportionally, we have more teachers in the world, right? In terms of employment in settings. So the concern is that also getting them some help, right? Because if you're afraid of where you go every day, we need to work with you, right? We want you to feel, we know you're going to be living and surviving a pandemic. You're going to have to live your life differently, but you can't be afraid of working in your environment. And that's, I think, a challenge for all of us.
And that's really what I was relating to, because I thought that they were incredibly terrified by cleaning.
Well, that's the impression I got too, that every letter was not satisfied with the process by their school district as far as cleaning rooms where there was possible exposure and after class.
And here's the challenge as well. So in a classroom, let's say I'm a sibling to another child, right? My sibling was the one with the symptoms, so I'm quarantined. There'd be no need to do anything different in that classroom. And remember, the cleaning occurs after hours, right? We don't clean immediately after we remove the child because the viral particles have to settle. Ideally, and it's in the after hours. And so the biggest risk essentially is not, and this is hard to explain to people, is the folks that are the ones that are cleaning, and they wear different kinds of cleaning gear. We sent them and they were, fit tested for N95 masks to be able to do that work. And I think several of the schools use a private contractor to do that as well. So someone there's all these tipping points, but we really do try and get them to a place where they can function in the work environment that they understand what their procedures are in that particular environment, whatever that is.
And I understand their fear. The hospitals early on had the same issue, but has what we've talked about and what you stated been explained to the teachers' unions or representatives? Any information that can be given to the teachers to let them know that, yes, there's cases in these school districts, but as of now, the cases are not from the class.
Dr. Williams, yes, first of all, we review it on the press conference almost every week. We also have that report that's out there, and the schools themselves have some, meetings internally. We have shared that with the unions. As you know, they're not happy because again, we've had to kind of really talk about it's not what's happening in the in-person environment, whether it's in that school. It's the out of school activities that are creating the infections. So, and then if we initially had some issues where, let's say, even if we all went to dinner together as a Board of Health and a health department leadership, and we suddenly had 2 of us were ill, we would all be quarantined, and that would take out the leadership of the health department and the Board of Health. It was really hard for adults to understand that. So we had some scenarios where, I'm a kindergarten teacher, you're a kindergarten teacher, and we decide, let's bring our collaborative together. We're going to bring the kids together. And in normal non-pandemic times, they have a space in those areas. And if one child then, or one of us became ill, then those 2 classrooms got impacted. And that was really hard because they're like, well, we've always kind of team taught and so, again, these school districts, many of them are very large, as you would guess, and local administration, we'd have to kind of talk to them about, is that how you plan this to be? Because if you read our school advisement, it was keep your classrooms cohorted, keep your teacher and your aide together, right? We go out to the playground together, we have lunch together, we go to the bathrooms together, right? We don't mix up with any other classroom at recess time, even if we just love being with those people, because really that was going to keep those environments safe. The problem is it's the Friday night activities where in a normal year, everyone gets together and does some downtime as a team. And this is the time you can't be doing it. So we've seen some of that just really being part of the problem. And again, everyone would like to say the tendency in this country that we've seen is to blame your work environment, whatever that work environment is, whether it's the school, the hospital, the factory, the retail store that you work in. And it's been kind of, as you do more interviews, God will tell us it's very much like the STD, interviewing.
Yeah. Yeah.
Okay. All right. Any other additions? Do we need to have an executive session?
No.
Excellent. Then we need a motion for adjournment.
So
For adjournment.
All second. Okay.
Second.
All in favor?
Aye.
Thank you all for your time, and be safe. And Sandra, I just want to say personally, thank you for being there to take all the arrows that are being shot, and doing it with poise. Because again, all those letters were directed to you, and they seem to be trying to make it personal. I understand, and we understand that you're doing the job that we hired you for, and I'm thankful for you.
Thank you. And I have as you see, a great team. I mean, when the arrows come flying, they make sure that we hold the fort down.
But thank the entire team. It's been a trying time, and COVID has made people behave in weird and strange ways because of stress. And I think the entire team and the entire Board of Health is doing a great job. Thank you.
Thank you.
Have a good night.
Well said.
All right.
All right. Stay safe, and remember November, and remember to do safe trick or treating.
Gotta remember that.
Okay.
Bye-bye.
Will do.
Happy Halloween all. Bye-bye.
Good night.